All right, what is up? If you're watching this live or if you're going to be watching it later, what I wanted to kind of talk about real quick, I got an email the other day, and I want to try to start doing live videos in regards to doing content on here that's answering questions for people who just email me. This is pretty much just conversation in the gym, conversation on the street, and through email. And I got an email the other day regarding an athlete, young athlete, who is looking to return back to activity, back to her sport, back to exercising after a spinal fusion. I believe it was her mother who was reaching out to me regarding her training. The email was pretty much asking, hey, this is my daughter, this is her fusion. It's in her lumbar spine, part of her thoracic spine as well. She's now doing exercises with her coach at school. What do you suggest pretty much would be her next step, or what are safe exercises for her to be doing now that she has been released back into the wild? I call it the wild, but and this is my answer. I mean, I kind of gave her really nice, detailed information, our email, to kind of give her some pointers or some tips or some direction on where she should take her daughter. My biggest concern when it comes to young athletes is the coaching that they're getting. Because I was a young athlete at one time. I played high school ball. I wrestled. I played volleyball and baseball. And the coaches were often teachers, were often people who just didn't know what they were talking about when it comes to athletics. Even the athletic trainer that the high school had was garbage. They were probably in college themselves getting a communications degree, and for some reason they got scored as a athletic trainer at the high school. And they just don't have the information. They don't have a knowledge base. So what I want to kind of give you is to school you on some basic information to take away if you know someone who's had a fusion, if you've had a fusion and you're looking to get back into activity. And you can kind of relate this to a lot of different lower back injuries. If you had a discectomy, if you have a ruptured disc or anything. But right now I'm speaking specifically to the fusion email that I got. So when it comes to getting back into your sport, if you've been released back into the wild, as I say, from your physician, the big thing that I always suggest is to continue with the rehab exercises. Do not rely on meeting back once a month, every other month with your physio or your physical therapist or whoever you're meeting just once a month or twice a month and doing the exercises. Then you've got to continue to do these exercises as you are continuing to progress outside of seeing this physician. When it comes to your sport, what I suggest you also do is probably not jump right back into it. Let's say you wrestle, or let's say you play. I think this person specifically was a softball player, and I think she was a catcher. Maybe I don't have the email in front of me, so I don't have that kind of information for you. But you have to think about what you're doing in your sport. If you're 4 weeks, 6 weeks, maybe, I don't know, 4 months, 6 months. I mean, I'm not sure how long your rehab was, or it all kind of depends on what your physician says. But you have to look at it from a standpoint of what are you doing now that you're back? If you're doing a lot of bending, if you're forced into positions where your spine needs to be able to have that mobility in that area to support that movement, but yours is fused, you have to think about that. You have to see, is that worth it? Is it worth going through all that, forces and just a lot of funky things happening once you get cleared? Now you're back into your sport. You have to kind of think, is it worth it? Is it all kind of being worth it to jump right back in? From a training standpoint, I would not suggest getting right back into squatting or right back into deadlifting or following any kind of program that your coach is suggesting that you do right now. I personally stick with the rehab stuff. Go back to your physio and say, hey, after these 6 exercises you want me to do for the next 3 or 4 months, what's the progression? If I do well, if I can do these pain-free, what's the next progression that you want me to be doing to continue, to get better, to get stronger? Because odds are your rehab is going to go far past what you've been doing with the actual physio or physical therapist. Okay, so your bank account or your insurance policy may not allow you to go past 4 to 6 months or 4 to 6 weeks, whatever your plan is basically. Then you have to have a plan B. What's going to happen after that? You find a good source to help you, coach you through that, or you get that information from your trusted therapist. So from there, I mean, I personally, I'm all about taking time off. As a young athlete, I understand you want to get back into it. You want to go full blown. You want to get right back into what you were doing before. But I don't always suggest that. I don't always suggest that, because what happens is, as a young athlete, or because you're taking pain medication, whatever you're doing, you jump back into your sport and you may not have as much pain. The medication kind of, covers the pain or whatever it may be. And you're fine. You may go through junior year, senior year, first year college, if you're even playing college ball. And then what happens is your body starts to break down again. It can only take but so much of a faulty movement, even after being repaired by surgery or a fusion. It can only take but so much. So what happens is when you have that fusion, so the disc that was fused may not be an issue anymore, because you just have rods going up and down the side of that. But now it's the discs up or downstream, if you even have discs up and downstream after your fusion. So that's what happens. So 4 years later, after continuing your sport, after jumping right back into it, not working on mechanics, not working on strengthening, building endurance in the area, learning proper movement, you're going to pay for it later. So I know this is not the video you probably want to hear. You want to hear like, well, how do I get back into it easily and do it pain-free? And it's not always the case. You have to think about what you're doing. You have to prepare. You have to always be thinking rehab-based. Rehab can include squatting. Rehab can include pressing and loading the spine with heavy weight. It can include that, but it has to get to the point where you're ready for that. Just because you're out of physio does not mean you're ready for that. I think finding a good chiropractor or physio who has that knowledge base, or who likes to take their patients past the actual clinical setting to the strengthening setting, that's where you want to be. You want to find those people who are able to do that and coach you along the way. So I hope this helped you. The email was obviously not this long, but this is a little bit more detail. If you want to have more information, if you want to have your question answered, I'm going to try to start shooting these live videos more often. So you can either join in live or shoot me an email at fitnessforbackpain@gmail.com. If you're a subscriber to this YouTube channel and you're watching this video and you're like, why the heck do you not make any more videos as often? Trying to do as much as I can, but my number one source for all of my content is actually my website. If you go to fitnessforbackpain.com, that is where I'm at all the time. Every single week I'm there posting articles. Sometimes I have time to make an actual edited video and post it up on here for you guys. But if not, all the magic happens on my email subscriber list and my website. So check it out. Thanks for tuning in, guys. I appreciate you. Make sure you subscribe to get into the next video session that I may shoot here soon once another question pops into my inbox. Thanks for watching, guys, and have a good day. Yes, I want to stop streaming.